Social Impact CX, the podcast that helps you drive mission and make a difference with customer experience.
Hello, everyone, and thank you for joining me for episode 38 of the Social Impact CX podcast. I'm John Corrigan, and I'll be your guide to how you can drive mission and achieve social impact with customer experience work. I appreciate that you're taking the time to listen, and I hope you enjoy this episode. I think it's going to be really interesting. For those of you who are regular listeners, fair warning, we're going to cover some really new territory in this episode. A gentleman by the name of Logan Murry will be joining me here on this episode of Social Impact CX. Logan will introduce himself as we get started. He's a very smart guy. He's a pharmacist and is presently working on his PhD in the field of pharmacy at the University of Iowa. Full disclosure, I personally have a special place in my heart for the profession of pharmacy. My wife is a pharmacist, and while her career path has been a bit different than the traditional role of dispensing behind the counter, which of course is a very important role, for someone like myself who's not a pharmacist by profession, I've always found it interesting to get exposure to what's going on in the world of pharmacy. And I have to admit that I find my recent conversations with Logan to be especially interesting, given my occasional views as someone looking outside in when it comes to the pharmacy profession. So in my other daily work outside of this podcast, I'm also a social entrepreneur. I'm founder and CEO of a startup company called JourneyMap L3C, which is a cloud-based application that can do journey mapping work in a more affordable and accessible approach. And JourneyMap, my company, as well as the application that lives in the cloud, is specifically designed so that customer experience work, such as measuring empathy and emotion, and then journey maps, which is usually pretty expensive work. So that work is more affordable so that it can be done by social impact organizations and nonprofits and educational institutions and small businesses like community pharmacies, which is we're going to get to Logan's work here, and then other businesses that might not have a huge budget to do CX work so that they can better understand the experiences of the people that they're working to serve. So Logan and I crossed paths in our pharmacy circles, if you will, and he decided to use my application JourneyMap as part of his thesis research to better understand a really important issue related to selecting Medicare Part D plans. More specifically, how community pharmacists in a rural setting can help retired people and elderly people who might very well be on a limited budget, how that community pharmacist might help someone select the right Medicare Part D plan for them. And that's important on many different levels, which we'll be talking about. From my non-pharmacist perspective, there are wellness and health and social impact issues all rolled into Logan's work and his findings. This episode of Social Impact CX is part one of my conversation with Logan about his work, and there will be a second episode to come as well. But before we get to the conversation with Logan, as always, I start each episode of Social Impact CX with a moment of gratitude. After I wrapped up the recording session with Logan, he and I were talking about meditation and mindfulness, which we're both interested in. And so my moment of gratitude here in episode 38 of Social Impact CX is for Dan Harris's book, 10% Happier. Because after Logan and I talked about 10% Happier, I went home and picked up our copy again. If you're not a meditator, or maybe you're interested in meditation but have not tried it so far, I'd suggest you check out this book. It's a good read, and it's a good starting place, I think, on the subject of meditation. And it's by someone you may have seen on TV. The author is Dan Harris, who's on ABC. So even though meditation is not always a relatable subject for everyone, this book might make it relatable, because I think it's fair to say someone like Dan Harris, who you see on TV, sharing his experiences and thoughts on a subject like meditation, it might be helpful. There's also a 10% Happier podcast and a 10% Happier app out there. So if those are more your speed, you may want to check out those as well. And one more thing, it just so happens that this episode was recorded in October of 2019, and it also just so happens that October here in the U.S. is American Pharmacist Month. In fact, every October is American Pharmacist Month. So happy American Pharmacist Month to Logan and everyone listening in who just might be a pharmacist themselves. I know that I certainly respect the work that you do. With that, let's get to this interesting conversation with Logan Murry about his community pharmacy work related to Medicare Part D and what he found during his thesis research using JourneyMap. Hello, everyone. I'd like to welcome Logan Murry to Social Impact CX. Hey, Logan.
Hey, John. Thanks for having me.
Absolutely. Thanks for taking the time to join me here at Social Impact CX. So, Logan's been doing some fascinating work that has social impact implications in the field of pharmacy. But before we start about that, actually, Logan, why don't you introduce yourself in terms of what it is that you do?
Yeah, so as John already mentioned, my name is Logan Murry. I'm a pharmacist and a current PhD student in health services research at the University of Iowa College of Pharmacy. A lot of my work thus far has focused on patient access, specifically in the pharmacy arena, so access to enhanced pharmacy services that drive outcomes, and then also getting a better understanding of the patient valuation of some of those types of services, and so figuring out how we can get patients to use services that we know work.
Good. Yeah. So I have, full disclosure, I have some insider connections with the University of Iowa's College of Pharmacy and Health Services, and so Logan and I had a chance to meet, and we were talking about his thesis work for his PhD program, and I brought up to him that I not only work in the field of customer experience, but also my other business, besides my podcasting efforts here, is that I have a startup called JourneyMap, and it's an online application. It's in the cloud and allows you to do journey mapping work in a much more affordable way. It's based upon ethnographic research and analysis. There's algorithms involved in that. It's designed to make it easier, much more approachable and accessible on how you do journey mapping work, which is usually really expensive. And there's more than one way to do journey mapping work. You can do custom ethnography and there's other approaches, but I offered to Logan, I asked him if he'd be interested in giving JourneyMap a try and doing some of his research, and he said yes. So what we've worked on here is that Logan incorporated journey mapping in a community pharmacy setting in some of his thesis work, and we have the results here, and I have to say it's really fascinating. So do you want to just give a top line about what your focus on your thesis work was, and then how you use the journey mapping work in a community pharmacy?
Yeah, and so really we wanted to get a better understanding in a rural community in Iowa about the patient experience with an advanced pharmacy service. And so using JourneyMap, we actually printed the services. You can do them via email.
JourneyMap's online, but you could actually take the survey instrument that's based in ethnography, remote ethnography actually, and you could actually print out the questionnaires and do the surveying in person on paper. In Logan's case, he had a population of retired elderly people in rural communities, and so not everyone has access to email, and so you can send out survey invite links via email, or you can print out the survey and then you can input the survey findings if your population needs to do that as well too.
Exactly, yeah. So we took the printed surveys down to a community pharmacy that was offering a Medicare Part D consultation service. We wanted to get a better understanding of the people that were using the service and their experience with Medicare Part D plan selection, and then compare that to individuals that were not using the service. And so trying to get a better understanding of how the service was benefiting that community and how we could potentially engage other individuals that might benefit from the service that were currently not using it. Right. And so one community pharmacy in rural Iowa was kind of where we piloted this and tried to figure out exactly what types of applications JourneyMap could be used for in that setting.
Right. So I think community pharmacy was a fascinating place to do this work, especially in a social impact context. And community pharmacies, for those who aren't familiar, there's the big chains you go to, like a Walgreens or CVS, but then community pharmacies are your corner drugstore, where there's a good chance, especially if you live in a smaller town or a rural community, that's the place you go to get your medications, and there's a good chance that you know them and they know you, and so it's a very interesting place to understand the experiences and the journeys of people as they're engaging with their pharmacists. And so JourneyMap has remote ethnography concepts built into it, and ethnography, again, it's a type of research that really measures empathy and how somebody remembers an experience, whether it was good or bad, whether they needed help. And so all those concepts are what you capture in JourneyMap, and then you can see what the journey looks like. You actually see an up and down visual display, and you get some demographic information in that. And so that's what Logan used in a rural community pharmacy setting.
Yep.
So, all right. So before we go too much further about the work that you focused on Medicare Part D, and everyone listening may not understand what Medicare Part D is. So let's spend just a moment. What is Medicare Part D and why is it important? Why did you select this?
So Medicare Part D is a public insurance benefit that's offered to individuals that are 65 and older to cover their prescription drugs.
These are add-on plans, correct?
Yes, add-on plans to regular Medicare.
To regular Medicare to hopefully help you better afford the prescriptions you need.
Correct, yes.
Okay.
And so I originally got interested in looking at Medicare Part D and Medicare Part D plan selection during my time as a pharmacy student. This was basically through conversations with my grandparents and other individuals that were in that 65 plus age category, realizing that especially in rural communities without internet, selecting plans through the Medicare Part D website was actually pretty challenging. And so unless you have an informed individual like a grandson who's a pharmacy student and now a pharmacist, or if you have another individual that you trust in terms of helping you make this decision, it can be particularly challenging. And so I wanted to get a better understanding of how we could improve individuals' plan selection experience and then subsequently help them actually pick better plans.
Right. When I heard that Logan was interested in researching this, I thought in his experiences, I'm just a touch older than Logan, and I know that my mom every year this comes up when the window opens to select your Medicare Part D plan. And even if you do have access to the internet, this is complex and it's confusing, and it's a dynamic marketplace with insurance companies that change different benefits or different copays or whatever with different plans, and it changes every year. And so I thought this was a fascinating area to do some research.
And so just a little more background on that, John, that we know from previous literature and then some of the work that I've done prior to this Journey Map project, we know that about 4% of the population that is eligible for Medicare Part D plans switch every year.
That's interesting.
The beneficiary has the potential to save about $400, so they're spending $400 more on prescription drugs than they actually need to be.
Right.
And we know that a pharmacy service actually increases switching, and then it subsequently has shown to increase medication adherence. And the reasons behind that we're not entirely sure of, but we know that using the service does lead to increased medication adherence.
So by potentially switching, you might be able to A, save money, and then B, by being able to better afford your prescriptions. Would it be correct to say that perhaps that also leads to better medication adherence, that people actually taking their meds?
Yep. Yeah, and we can't say for certain that it's because of the cost savings, but we can say that utilization of the service drives medication
These are
adherence.
all elements in the mix.
Yep.
And I think when you get to, the reason why I was interested in this from a social, because of course community pharmacies are small businesses many times, but I think there is a key social impact element here, because this gets right to whether or not a retired person can or cannot potentially afford their meds, which may be absolutely critical to them and their health. Is that correct?
Yeah, absolutely. And this is something that from an individual testimony that I've seen just working with my grandparents on their medications. And 1 year, something is a tier 1 prescription, and so it's covered, or the vast majority of it's covered by their insurance plan. And then the next year, that item moves off of formulary or becomes a lower tier. And so all of a sudden, their out-of-pocket costs are jumping. And then there's a number of questions about, well, what's a better medication? Could I be on something else? Do I really need this medication? So there's a lot of uncertainty that's involved with those formulary changes, and that subsequently sometimes leads to individuals questioning the actual medications that they're on. And so it's a really uncertain process, and the insurance.
And this is not just for specialty medications and new and emerging stuff. This is for some pretty standard medications that many people need to take, right?
Yeah, and so it certainly has the potential to impact specialty medications, but we see it in things like insulin, just relatively routine diabetic medications, a lot of those medications that you don't really think about in terms of being affiliated with some of the higher costs. Insulin obviously being an exception to that with how much that's been in the news more recently.
Right.
But yeah, some of the medications that a large number of individuals are on and need to be on to control their disease states are subject to some of these price fluctuations in formulary.
Right. Great. So that's why this was such an interesting area to research. And so, all All right, so I want to get into it with Logan about exactly what this research was and how he did the work, and he found some very interesting data variances he can describe. Before we start that, though, I think what's really important to note is that what I've noticed in the world, when you get to the subject of patient experience, not just customer experience, two major trends or phenomena that I've seen is that, number one, there's a lot of organizations that do surveys. They do satisfaction surveys, and they call that patient experience. And that doesn't get to the experience. It gets to whether or not people are satisfied with what you're doing. But that experience, the journey, is really offers so many more points of insight and opportunities to engage and intervene and provide a better experience, that there's a lot more work to be done than just surveys in the world of patient experience. And the other thing is that many times when you get to a conversation about patient experience, there's this wall that's thrown up, and people say, well, there's HIPAA, and because of HIPAA privacy, we can't do that. And what's fascinating is that there are all sorts of opportunities to look at how you can provide a better experience for your customers or your beneficiaries or your patients, whomever it is, that are outside the purview of HIPAA. And so, if somebody can't park at your health clinic or pharmacy or whatever it is, they're probably not going to come there as often or as frequently as you would like them to. Your parking has nothing to do with HIPAA data. And so, of course, there are areas in the healthcare world that an experience has to do with personal information and personal healthcare information. But there's a lot of work to be done outside of HIPAA constraints. And that's actually where I think Logan's done some really interesting research. So,
yeah. John, I think you're absolutely correct. And from a pharmacy standpoint, this is something that we've seen historically from an evaluation standpoint, was the patient satisfied? And so in this context, the Medicare Part D consultation is free to the patient. And so there's not a lot of scenarios where an individual would be dissatisfied with a free service. And that's something that we've seen time and time again. And so what JourneyMap has allowed us to do is actually get a better evaluation of what's actually going on for the patient. And so what are the high points of the service? What are the low points of the service? And so outside of just, well, it was free, so it was good.
Right.
This has allowed us to even identify shortcomings or huge benefits that people have received outside of the relatively rudimentary satisfaction measure in this context.
Right. So there's nothing wrong with measuring satisfaction. It's just that's one step when there's so many other things you could be doing to better understand the experience of a patient or a customer, or a patient who is a customer, which in the case of community pharmacy, you kind of use that term sometimes interchangeably depending upon what the experience is. So, All right. So, so you described that you use paper-based surveys, and I know you engaged the pharmacist to get the surveys completed. Why don't you tell us a little bit about the findings? So one of the things that's always good to do, because journey mapping work using ethnography, whether it's custom research or remote ethnography like JourneyMap, the application uses, you're using smaller populations of people. And so having an A group and a B group so that you can compare and validate to make sure you didn't have a group of outliers is always good. And so Logan had an A group and a B group, and it provided an opportunity to see some really interesting differences and variances in the experience. So let's talk about the data and what did we learn here?
Yeah, and so for our two personas that JourneyMap created for us based on the 18 surveys that were completed by both our A and our B group, the A group here being individuals that used the service, the B group being those that did not.
Right.
We have two different emotional journeys that our patients went on, which we have named them Beverly and Susan after my grandmothers.
That's very important. And I think it's great that it was Logan's grandmothers. The names are here for the personas, if you will. With JourneyMap, you get kind of a thumbnail of a persona. If you're approaching this in a different way, I still suggest that you put a face and a name on your work. It's really important. So our two groups were Beverly and Susan. I think it's a frequent theme that you find women are more engaged in healthcare decisions. And so the representative respondents in each of the A group and the B group were women. And they were both groups were over age 65, correct?
Yep.
Yeah, okay. There was one really interesting variance, though, between the A group, which used the Medicare Part D consultation service in the community pharmacy versus the B group that did not use the service offered by the community pharmacist. And what was that?
What we found from just some of the basic demographic and descriptive information is that the individuals that used the pharmacy service actually fell in a slightly lower income bracket than the individuals that did not use the service. And so from a social determinant of health standpoint, income seemingly drove individuals' decision-making around who to use for the service, and then obviously subsequently impacted their overall journey. So potentially could be contributing to the experience.
Sure, exactly. And also a clear implication as to who might or might not be able to afford medications that are or are not covered in by their Medicare Part D plan then. So so that was really interesting as we play out what the findings were, that income variance between the A group that used the service and the B group that did not, that's going to come back. And so all right, so let's a bit of a spoiler alert, and we'll come back to this. What I found fascinating when I first saw these two groups was that they both ended up in the exact same place. Journey Map shows you high points and low points where people were happy or unhappy. They both ended up in the exact same place. Their journeys to get to the end result, though, were very different. And that to me really caught my attention. So, Logan, why don't you tell us a little bit about the journeys of each one and then what was different?
Yeah, and so the benefit of having the A and B group here again from a statistical standpoint is that we were actually able to use statistical measures to compare the two groups.
Right.
And really what we found statistically is the individuals that used the service generally had a higher sense of collaboration. So obviously using the service here, they felt like they had an opportunity to discuss their plans more. They had a little bit more engagement with a collaborative relationship that allowed them to help kind of make this decision. And they also had an opportunity to actually compare plans. And so individuals that used the service had an opportunity to kind of look through the different plans with their pharmacist for better or worse, as we'll see within this next point, is that using the service actually led to a more challenging decision-making process. And so,
but a little more challenging process might not be bad, though.
Right, and challenging might be informed.
Yes, exactly. The more you know, you do have to sort through all that, but you know more. So,
and then as John already mentioned, then all of these individuals actually ended with similar levels of uncertainty about their future based on their plan selection. And so, regardless of what the overall journey was, there was still considerable opportunity to kind of improve that last component of the uncertainty in both groups.
Right. So, what kind of jumped out at me because there were, and some of the pictures of the journeys are actually on the Journey Map website. That's journimap.com. So there's a tab on the Journey Map website that's called Journey to Help, and Logan's case study is the first Journey to Help case study, and you can see the pictures of the journeys there. What really jumped out at me looking at these results, mapping data points on kind of an XY axis here, is the ups and downs. With the A group, clearly demonstrated it was more challenging. The B group had fewer ups and downs. It was a smaller variance, I think, between the good experiences, bad experiences. But what seemed to come through was that by engaging with a pharmacist, the A group, Beverly, became much more informed and really, had a clear picture of what she was trying to decide, and which there are ups and downs to that. The B group, Susan, who had a higher income, so Beverly represented an average household income of $25,000 to $40,000 a year, and this is in retirement. And then Susan's average household income was in the next category higher. It was average $50,000 to $75,000 household income per year as a retired person. And so Susan, from the commentary, and I'll let Logan talk about this, many of the individuals that contributed to the Susan persona, they were talking to advisors, but they weren't necessarily talking to a pharmacist, which that was really interesting. What do you think the difference was there?
Yeah, so I think that's a really interesting point, John, and something that we didn't necessarily expect to see within the data. But again, that's one of the benefits of Journey Map, is that we have this qualitative component, at least from our standpoint. We were able to get all these qualitative responses and then subsequently code them and then use those qualitative responses. And for those of you that don't know what qualitative means, basically just open-ended responses where an individual had an opportunity to write some free text about what their experience was like.
Right.
And so really what that allowed us to do was kind of pinpoint who was using a different type of information source in order to go about their Medicare Part D plan selection process. Additionally, what we found within both groups from some of the qualitative work was that trust was a hugely influential component in both of these groups. And so trust in a financial advisor, which we saw on the Susan group with a higher income to use more frequently. So an individual associated with their finances or also previously making a financial decision themselves.
Accountant, insurance agent, financial planner, somebody like that. And I know there's a lot of people who do engage with an advisor of that nature when the window opens and they need to choose their Medicare Part D plan each year. So the B group was many times turning to an advisor of that type, and the A group was engaging with the pharmacist.
Mm-hmm. Which, again, we can only kind of think about in terms of that, how universally true this is, but it seemed that the individuals in the higher income bracket were using someone that they had historically trusted being a huge component here, with their finances. And so that trust extended into the healthcare financial arena as well.
Which this is where you get to social determinants of health. Social determinants of health, if you're listening and you're not familiar with that, if someone lives in an inner city in a food desert, they don't have access to grocery stores, that's going to impact their ability to have good health. Well, if you're a retired person and your needed medications are outside of your financial means, that's going to be a social determinant of health if you can't afford your prescriptions. And so I thought it was so interesting that the lower income group had engaged with their pharmacist, and while they had more ups and downs in terms of the journey to picking a Medicare Part D plan, they had a more informed decision. And actually, we don't know everything about the finances of these individuals, but if they have a lower income household, the cost of their prescriptions are going to have a higher impact on their ability to pay. I thought it was just a really fascinating finding that came out here.
Yeah, absolutely. And then also within the A group, so the individuals that use the service, they had a harder time putting that trust in a pharmacist making a financial decision or informing a financial decision, and that could be because they have historically not experienced that type of relationship with their pharmacist, or maybe they were just relatively untrustworthy. As the literature shows, as you age, you become less trustworthy in terms of your overall trust with an individual, regardless of how trustworthy they actually are. So elderly individuals just more trusting in general, unless it's around financial decisions, in which case they have a hard time trusting people.
That's interesting.
Regardless.
Right. So if it's a financial decision, it's hard to trust someone, period, for this demographic. So what's interesting here is that, so as I said before, you can do journey mapping work a lot of different ways. If you're in field with custom ethnography, you're going to come back from field from that research of sitting across the table from someone or in their living room or in a pharmacy or whatever, and you'll be able to write down all sorts of verbatim comments or have them recorded so that you know what they said. In Journey Map, there's several different places where people can offer up commentary, and there's open text boxes in the surveys so that you can get these real comments from the real people taking the surveys. And what was fascinating was that this predominant theme that came back from both the A group and the B group in Logan's research was trust. And so now a community pharmacy is usually a small business, and so of course they're interested in the relationship with their patients, their customers, on more level than one. Of course, there's a lot of intent to help people, but also, the relationship with the customer, as the patient is also pretty interesting if you're wanting to make sure that you're doing new and innovative things in your pharmacy, and you're trying to figure out what services you could offer and different ways to cement that relationship with somebody. There's a lot of interesting implications here as well too, I think.
Yeah, absolutely, John. And from an additional application component of this, at the end of the Journey Map survey, there's an opportunity to provide additional contact information, which a number of our individuals did. So depending on your time and budget, which as a graduate student, I have none of both, depending on those two things, you could actually go in and you could do some of the more traditional ethnography type research. So you could hold focus groups, you could do additional qualitative interviewing, or those types of things to better understand the particular experiences that the individuals that left their contact information gave. So we could really, if we wanted to, we could explore trust much more thoroughly and kind of develop a potentially better theoretical model as to how that was contributing. And so the opportunity for expanding your ethnography work based on Journey Map is...
Or whatever you're doing, exactly. This has been Social Impact CX Podcast Episode 38, the first part of my conversation with pharmacist and pharmacy PhD student Logan Murry, who's working on his thesis at the University of Iowa's College of Pharmacy. And in terms of covering new territory, which I mentioned at the front of this recording, I think this is the first time I've talked with someone here on Social Impact CX who used the Journey Map application that I've been working on the past couple of years, and then after using Journey Map has sat down to talk about what they learned about during the process and what the findings are all about and what this all means. On the Journey Map website, and that's journimap.com, I've pulled live a new tab called Journey to Help, and Logan's work is the first feature there. And just to note, my company Journey Map and this podcast are certainly separate entities, but when their paths cross through social impact situations and examples of work where journey mapping is used to help others or to make the world a better place somehow, I plan on sharing occasionally here at Social Impact CX. So if someone's work qualifies as a journey to help over at Journey Map, then you might hear about it here at Social Impact CX. Do you have thoughts or questions about Logan's work or journey mapping, or how customer experience practices like journey maps and empathy work can be applied in a healthcare or patient experience environment like a community pharmacy? As always, you can ask a question or make a comment here at Social Impact CX a couple different ways. First, and maybe the best option, is you can send an email to comment@socialimpactcx.com. That's comment@socialimpactcx.com. You can also find us on Twitter and post a question there. Our Twitter handle is @socialimpactcx. And please follow us on Twitter to stay up to date with new podcasts and other related content. You can also find me on Twitter. My handle is @JohnFCorrigan. Feel free to reach out to me as well. We've expanded where you can find Social Impact CX online, and you may be listening from someplace like Spotify or Apple Podcasts or Google Play or SoundCloud or YouTube. If you've not found Social Impact CX wherever you usually get your podcasts, please let us know, and we'll look into expanding to wherever you normally are. This is John Corrigan reminding you that, especially in social impact work, it's important to understand that your mission is really all about someone else's journey. And the more you know about someone's journey, the more you can help. Thanks for listening to Social Impact CX.